Your time right now, 5:49. An estimated 100,000 people in the U.S. are living with sickle cell disease, and each year 1,000 babies are born with that disease.
September is Sickle Cell Awareness Month. The American Red Cross is urging more people to donate blood in order to help. Eden Checkol's live at the Red Cross's Badger chapter this morning with details on how you can help. Good morning, Eden.
Hey, Adam and Danica, good morning. So the American Red Cross is certainly asking for more blood donors, but the organization is also calling on people of all ethnic backgrounds to donate blood. And this morning I have Barbara Beeling from the American Red Cross and Martin Lackey, who is from the Sickle Cell Committee. So thank you so much for being here, you guys. Now, Barbara, for starters, what exactly is sickle cell disease?
Sickle cell disease, it's a hereditary disease which affects your red blood cells. So instead of them being round and soft, they become very hard and elongated, kind of like a sickle. And what happens then is it slows down the movement of oxygen through your body, which of course makes you very anemic, can give you extreme pain, along with a number of other ailments.
Now, why is it so important to have people of all ethnic backgrounds to donate blood?
It's so very important because blood contains up to 600 antigens, and with that they are very specific to some ethnic groups. And so if you have a person like Martin who has sickle cell anemia, it's important for him to get a similar blood type.
Now, Martin, thank you again for being here this morning. Why is it so important for you to bring awareness to sickle cell disease?
Well, because I had a sister that passed away from sickle cell disease in her early 30s. And I believe it's a big awareness that most people don't know exists. And a lot of people of my gender have sickle cell anemia, and we need people to donate blood for me to pretty much to exist and be able to function on a daily basis.
Now, for people who aren't too familiar with sickle cell disease, tell us about some of the everyday challenges that come with it.
Well, I have to regularly use oxygen to help me function. I take pain medication on a daily basis, and some days it's just hard to move around, hard to function, hard to do some of the things that everyday people can do on a daily basis.
And this is something that is hereditary, correct?
Yes, it was passed on from my mother and father. It's passed on to your kids with two people that have the sickle cell trait. The kids tend to have the sickle cell anemia disease.
Thank you so much. Again, so 100,000 people living in the U.S. have sickle cell disease, and the body is less likely to reject blood from donors with similar ethnic backgrounds. And people who do carry sickle cell traits can still donate blood, and blood can be donated every 56 days. Adam and Danica, coming up, we're going to talk to another person who has sickle cell disease. But keep in mind that up until September 30th, you can donate blood. Of course, the American Red Cross is always willing to accept blood even after that. But if you do until the 30th, until the end of Sickle Cell Awareness Month, you can also get a coupon for a free haircut. And we're going to have on our website all of the locations and the times where you can donate blood. We'll have that on our website at channel3000.com. Back to you.
All right, Eden Checkol reporting live over at the Red Cross this morning. Eden, thanks so much. And we are taking a closer look at sickle cell disease. According to the CDC, it's most common in African American and Latino communities.
But as part of Sickle Cell Awareness Month, the American Red Cross is really calling on all of us, people of all ethnic backgrounds, to donate blood. News 3 this morning, reporter Eden Checkol is live at the Red Cross this morning with more on how all of us can help. Good morning, Eden.
Hi, Adam and Danica. Good morning. So sickle cell disease is basically a blood disorder that is inherited, and it affects about 100,000 people living here in the U.S. And this morning, I have Barbara Beeling from the American Red Cross and Marina Foji, who is from the Sickle Cell Committee. So thank you again, guys, for being here. Now, Barbara, here's what I find interesting. So blood donors, people of different backgrounds are not as, it's not as common for them to donate blood.
That is true, and what's most important is that people who are African American or of Latino heritage typically have an O-negative blood type, and that blood type is the easiest one and most acceptable by people who have sickle cell anemia. And so that's why it's so very important, because you are more apt to save a life.
Now, how many pints of blood can one person, a single person, use up within a year?
We know people who can take anywhere from 50 units of blood all the way up to 100 units of blood. So that's a huge amount. And when each person is only giving 1 unit of blood every 56 days, it really takes many donors to keep these folks alive.
And we were talking about this earlier, which I find interesting, but with all the advancements that we've seen, right, it's interesting that we still need donors, right?
Absolutely. Science cannot manufacture human blood. It can only come from another person. And that truly is fascinating with all the advancements in science that we've had.
Now, Marie, I want to come to you real quick. So I know that you do have sickle cell disease. When did you find out? What was that experience like for you?
Well, I was born in a third world country in which things weren't as developed. I believe I had my first major pain crisis around 5 to 6 years old, in which I had to carry that pain to travel to the next country, which was 3 hours away. You can only imagine how the hospitals were. It wasn't like the ones I have here. So from that age on, that's when I knew that this was a disease that had to be taken care of.
And you're from Togo. You said you came to the U.S. about 12 years ago. How are things now?
Things are way better. My crises have decreased, which are bone pains that we sickle cell patients usually go through. It could be daily, it can be monthly, it varies. But things have really taken a turn, and I don't see myself in the hospital often anymore.
For people watching who may not be, real quick, if they're not as familiar with sickle cell disease, what do you want them to keep in mind?
To keep in mind that sickle cell patients, when they are going through their pain crisis, it's not a visible pain that one can tell. So sometimes we do look good, like you might think that I may be feeling like a 10, like in pain-wise, but I'm really like just looking good on the outside. So it's nice to keep in mind that these people are not just looking good just to look good or lying or things like that. It's also important for parents to know who their partners should be, who they should choose, because 2 sickle cell traits, that's the beginning to a patient, that will have sickle cell anemia.
Thank you so much, Marie and Barbara. I do appreciate it. Again, it is Sickle Cell Awareness Month until September 30th, and you can donate blood. Come to any of the locations. We're going to have all the locations listed on our website at channel3000.com. For anyone who does come to donate up until the 30th, you can also get a free coupon for a free haircut. So we'll have all the details on our website at channel3000.com. But again, Adam and Danica, about 100,000 people living in the U.S. have sickle cell disease, so this does impact a lot of people.
Important stuff.
Yeah.
Thanks, Eden.
Appreciate your work this morning.